Hi guys, it's Shriram Sulya. Welcome to FIBO 104 FM. It's our privilege, it's our honor to have a doctor sitting amidst us in the FIBO 104 FM studios today. Ladies and gentlemen, we have consultant orthopedic surgeon, Fortis Hospital in Cunningham Road, has Dr. Chirag Thonse, who is here in the studios. Welcome, Dr. Chirag. Lovely to have you here with us.
Hi, Shriram.
Now, Dr. Chirag's core expertise include arthroscopy surgeries of the shoulder and knee. He does complex ligament reconstruction, joint replacement surgeries of the shoulder, knee and hip. He's a busy man. First of all, even before we start talking about the field of orthopedic science and orthopedic surgeries, what's your day like, doctor? It must be one busy day after day.
I wouldn't say that. I mean, it's good to be busy as a doctor, you know. At the same time, it's a sense of satisfaction if you have a good, fruitful day, that you have got so many people pain-free and you treated them and they all can bounce back into their normal life.
Right, and you play a very major role in making sure that people get back on their feet and they are up and about. Today on the show, we'll be talking specifically about sports injuries. We all wish to be sports rock stars. We all wish to be athletes. At least that's what the dream is, and we go on to try about it as well. Physical education is so very important during our schooling years, and then we tend to grow up. Once we get busy with our careers, somehow the amount of attention or the amount of time we set aside for sports drops drastically. In spite of it, some people actually take their time out in doing some amount of sports over the weekends. But doctor, what exactly are sports injuries? Can you put them in a category as such?
Let me just tell you, Shriram, as I walked into your studio, I saw a couple of your colleagues having some bandages around their ankle, somebody a splint in their hand. Would have been a simple fall in your office itself, but that all accounts to a sports injury. Now, when we talk about a sports injury, it's not only restricted to a sportsman playing in the field. It could be any form of injury which is encountered while playing sports or otherwise, which would involve knee injuries, shoulder injuries, ligament injuries, or muscle or tendon injuries. It's a comprehensive term used to categorize a group of injuries which are usually commonly seen in sportsmen.
Lovely. And since you are one of the most renowned consultant orthopedic surgeons, I'm sure you have a good pulse of the city and how so many patients may be coming across with some amount of frequent injuries that happen. What are some of the most common injuries that you get to see?
Yeah, now as you rightly mentioned, weekend sportsmen. These are the people who are commonly prone for any form of injuries. Most commonly what people come to us is with the simple ankle twist, ankle sprain, which would be of various grade. That's the most common sports injury one would encounter. Of course, furthermore, knee injuries are very common, ligament injuries in the knee. Sometimes people do come to us with shoulder dislocations, muscle or tendon injuries, back injuries. So all these are like quite common scenarios what we see nowadays.
Right. It brings back memories of when I had a twisted ankle. I was playing football, I was running as fast as I could, and there it was, that moment when my ankle twisted, and within no time it was swollen. I had to be in a cast for a good whole month for it to recover. Recovery plays a key role as well. We'll get talking about that in just a little bit.
Let me ask you, Shriram, did you do the RICE protocol?
I'm sorry, the RICE protocol?
Yes.
What is the RICE protocol?
Oh, this is a very interesting protocol. Now, any form of injury, you said you had an ankle twisting injury. Suppose you knew this RICE tips, you would have been much more comfortable before seeking help from a doctor.
Right. What is a RICE protocol?
It's a rest, icing, compression and elevation.
Right.
A simple protocol for any form of ligament injuries or sports injuries, where you need to immobilize that joint or the part of the body. Give a little bit of a compression with a crepe bandages available in any pharmacy. Cold compress and keep the foot elevated or the limb elevated whenever you have such injuries. It will save you from a lot of issues in further.
We'll keep that in mind. We are getting to know something new, the RICE treatment.
Yes.
Thank you so very much, Dr. Chirag Thonse, consultant orthopedic surgeon, Fortis Hospital in Cunningham Road. Doctor, is it always sportsmen who encounter sports injuries though? Coming back to sports injuries that we were talking about.
You don't look like a sportsman, Shriram, isn't it? You just told me that you had an injury, so it's similar. I mean, like anybody can have a sports injury. I mean,
this is insulting. You don't look like a sportsman.
No, you do look fit, but looking at your schedule, like I hear you in the morning and in the evening, I don't think like you have enough time to go ahead and play. Probably on the weekends you may play some sports.
Mostly on the weekends when friends get together, and it's true. You're pretty spot on mentioning that. When most of the friends get together, immediately after playing, then people head out to a bar. People actually stand about. There's a lot of binge drinking that happens after you play a game of football as well.
Yes, of course.
So you can imagine how serious these football sessions are.
So that's very true, and this is all taken in a lighter sport, lighter mode of sport. Like it's more for a recreation than your profession.
Correct.
So when it's for a recreation, and when we do it once in a while, that's when we are prone for more injuries.
Okay. And what are some of the most common sports injuries in today's scenarios that you get to see?
Yeah, as I said, ankle injury. Secondly, we have a lot of ligament injuries in the knee joint, which is very common nowadays. Simple twisting injury of the knee can rupture a ligament, and then the knee could become unstable or painful. This is a common scenario what we see nowadays.
And what about the risk factor attached to this? Let's say if somebody has a twisted ankle, is it something that this person has to deal with, or is it going to be a spot of bother for this person for the rest of their life? What are some of the long-lasting risk factors associated?
Yeah, that again depends on the nature of the injury. I mean, it could be a simple sprain, which in our terms we call it as a grade 1 sprain, which could be might as well treated in a week's time, and the patient can resume his normal activities in a week. Furthermore, if it's a complete rupture of the ligament, if it's a grade 3 sprain, which is much more severe in nature, then it may leave with a little bit of discomforts in future days. It all depends on when the patient seeks help from the doctor. A right treatment is very important, and of course, rest is very, very important.
Right. Now, since we are talking about sports injuries, we can't leave aside gyms. There are so many gyms across the city, and so many people take the time out in visiting gyms. They feel liberated, they feel happy, endorphins kicking in when they go out and do weights. Of course, some of them are guided through personal trainers, some of them do it at their own risk. The internet is helping a lot of people with the right technique to lift weights or not. But what are some of the risks attached with excessive training in the gym and injuries caused due to that? Because after a good session at the gym, your body is in pain, and some people say that this is a good pain and you actually have to go through this.
Yeah, now most commonly when I ask my patients what sport do you play, they say I go to the gym. So it is, to put it nowadays, it is considered a form of activity. I mean, considered a form of physical activity, which would be again giving some form of fitness, flexibility and strength to the body. Now, gymming in a right way is good, whereas something where one would push himself just for a transient bulking of muscle, or probably one would just assume that he would get stronger just pushing in more weights, may not be the right thing to do. I mean, we need to know the endurance of our body, the capacity to which we can handle, and where we need to stop. Of course, trainers do play a major role in this. I mean, a right trainer, a right way of workout is always helpful, and that's the right thing to do.
Right. Immediately after you step out from the gym, there's a whole lot of resting that's also required, I guess. People don't get enough sleep, and still they end up straining themselves a whole lot at the gym. Would you say all of it is advisable?
Yeah, sleep is another, but it does form a part of our day-to-day life, and for a good performance in terms of physical performance as well, not only the mental performance, for a physical performance, for the body to regenerate and replicate, the next morning you need to have a good, at least about, I would say, for a youngster, at least about 6 to 7 hours of sleep is very, very essential. That would give us more of an energy, more enthusiasm the next day, rather than exerting ourselves and pushing ourselves In terms of rest to the body, of course, post-workout stretches is very, very important. This is where we fail. One goes to the gym, does a little bit of weight, and then there's no stretching exercise which is done. So one needs to stretch out the muscles or whichever part of the body he has worked out for that day, and of course an adequate rest at least for half an hour to 45 minutes following his workout is very important. This would probably give enough time for the muscles and tendons to recover from whatever strain they've had during the workout.
I think a lot of us listening to what you're saying, doctor, we will be taking notes because we are getting to know a whole lot. Of course, stretching is so important. We came to know about something called as the RICE treatment as well. Dr. Chirag Thonse, he's consultant orthopedic surgeon with Fortis Hospital in the studios of Fever 104 FM. We are especially talking about sports injuries. Now, doctor, what is the common knee sports injuries you encounter? Lots of people who come up to you with knee problems as well. What is a commonality here?
Many. Nowadays you see knee injuries are very common. Probably the kind of sports what we play, the turf which we play in. Now many of us do play in synthetic courts these days, and these synthetic courts, if they're not properly done, one would be very prone for such injuries. One could just get his foot entangled, twist the knee joint, and then rupture one of his ligaments. Most common injury what we see with the knee is something called an ACL tear, an anterior cruciate ligament tear. This is a very critical ligament in the knee joint, and that rupture is I would say of late we see a lot of young patients with these injuries. Secondly, one could come with a meniscus or a cushion tear of the knee joint. One could also encounter a cartilage injury, or else some form of another ligament tears in the knee joint.
Right. It's interesting that you mention these body parts or the joints that are in our body. If we are to take a few baby steps at this, since you're an orthopedic surgeon, doctor, what is a ligament? Because people tend to at least say when their body is in pain that, hey, I have a ligament tear, and people use it so very casually. What is a ligament for our knowledge?
Yeah, it's very important that all of us do understand what a ligament is, and we need to differentiate it from a tendon and a muscle. Now, any structure which joins two bones, now you see that two bones are free bones, and these two bones need to be joined with each other to provide some form of a stability, and the structure which joins two bones is called as a ligament, and this ligament would provide stability to any joint. Whereas when a muscle gets attached to the bone, this ends in form of a kind of a structure which is termed as a tendon.
Okay.
So a tendon is a structure which joins a muscle to the bone, whereas a ligament is something which joins two bones together.
Lovely. And what about a cartilage?
Cartilage is the smooth surface of any joint. For a joint to be normally functioning, it should have two smooth surfaces. In case these smooth surfaces are damaged, then one would have pain. So these two smooth surfaces of any joint is called as the cartilage.
And while we are on the subject, care to tell us what the meniscus is also about?
So meniscus is it's a cushion, it's a shock absorber. Now suppose one is walking, what protects the two bones of the knee joint is this shock absorber called the meniscus. It takes away a lot of pressure from the knee joint.
Right.
And it's a very, very critical structure in the knee joint.
Fantastic. Now, you did mention that there are plenty of ACL related issues that you are dealing with, and since you're an orthopedic surgeon, you have a good pulse on what people usually go through. How important is an ACL ligament? This is something that you mentioned a lot of is becoming common these days.
ACL ligament, I would say, is one of the most crucial structure inside the knee joint. For a simple fact, a gentleman without ACL ligament intact may not be able to perform his normal sporting activity. Now, anterior cruciate ligament is a structure which provides stability to the knee joint, especially the pivoting kind of a stability. If one were to play a pivoting sport, like in a cutting sport, one would want to play squash, one would want to jump or perform any single-legged sporting activities, and ACL is very, very important in such kind of scenario. Of course, there are other structures which do add on to the stability of the knee, but one most critical structure in the knee joint for the knee stability is an ACL.
And does it need immediate attention and immediate treatment?
Now, it depends on what kind of an ACL tear one has. It could be ranging from a simple sprain, a partial ligament injury, or a complete ligament injury. Of course, if one would suspect any form of a buckling sensation in the knee joint, where one would feel that a little bit of apprehension while running down the stairs, one would feel a little apprehensive to play any sports. If one would feel that my knee is a little weak, it's definitely a good idea to consult a specialist and get himself checked for a ligament injury, especially the ACL.
Right. I think sometimes we tend to keep an orthopedic surgeon as the last resort, and we tend to push our bodies as much as possible. It may take 2 or 3 sports sessions, and then for the pain to still sustain, for somebody to actually visit a doctor. What would you say are the signs of actually visiting an orthopedic surgeon and probably having your body checked? Should there be a routine checkup that needs to happen with one's body?
In today's scenario, I think it's a must, because the kind of activity level like all of us are encountering in today's day-to-day life, and the kind of injuries what we encounter, I think it's a good idea to make friends with orthopedic surgeon. Now you have me, you see. So and more doctors are very accessible these days, and we have many orthopedic surgeons, especially specialists in sports injuries, many in our city, with good access, with good knowledge, and the diagnostic skills are great. The treatment lines have changed drastically in the last decade, and everything has become so precise. So why wait? If you have any doubt in terms of your performance or in terms of any form of an injury, it's always a good idea to consult an orthopedic.
Right. We also have plenty of techies who are probably listening to this, people who are involved with sitting in front of the computer for so long. I want to talk to you about some shoulder injuries in just a little bit. I also want to get down to the details of arthroscopy. But how is the meniscus injuries treated most often? Does it involve invasive surgery, minimal invasive that usually happens?
Meniscus injury is it's like a platter. You can pick and choose the treatment lines what you want. All depends on the kind of injury you have, the patient's profile, and of course the patient's activity demand. Now, a cushion, as I said, is very important, and especially in younger individuals. If it's somebody of 30 years or 40 years, meniscus plays a pivotal role in the knee joint performance in any form of sports. So intact meniscus is very important. Assuming a person has a meniscus injury and is constantly having pain, or one is having a locking sensation of the knee joint, then he needs to see a specialist, and based on the recommendation of the specialist, one could either get treated with physiotherapy and strengthening if it's a milder form of injury, and in case of a severe form of a meniscus injury, it may need an arthroscopy, a keyhole procedure, and may need to be stitched.
Dr. Chirag Thonse, he is consultant orthopedic surgeon at Fortis Hospital in Cunningham Road. His core expertise include arthroscopy, surgeries of the shoulder and knee, complex ligament reconstruction, joint replacement surgeries of the world, knee and hip as well. Dr. Chirag, I want to ask you about these signboards that I've seen across the city. Sometimes when you go over to rural parts as well, you get to see them. A man with a cast on his hand, and it says bone setting center. How safe are these bone setting centers? And these must be ancient ways of treating injuries. Does it actually make sense? It looks scary and funny at the same time to actually see these bone setting centers.
Yeah, see, we have all evolved. I mean, we have all evolved in terms of our lifestyle, in terms of our knowledge, in terms of science, and everything needs to be done in a scientific manner. I wouldn't say it's a wrong way of treatment. Probably a few decades back, when the science was not so advanced, it could have been one of the saviors for many patients. But at the same time, I've seen a few patients do well with this kind of a treatment. But the downfall of this kind of a treatment may be at times non-recognizing the complications which could happen because of these kind of treatments. So I think in today's world where we have an access to a lot many hospitals, it is always better to get the right treatment.
Absolutely. Now, since your expertise involves arthroscopy surgeries, care to explain to us what is arthroscopy and what are the fine details involved with it?
So arthroscopy basically means looking into the joint through a keyhole. Now, if you look into the keyhole there, you could see the entire room from the other side. So through a keyhole, you look into the joint and treat the desired pathology through a keyhole. This is basically a minimal access surgery, where one would make minimal incisions into the joint, put a telescope inside the knee joint, visualize the nook and corner of the knee joint or the shoulder joint, recognize the problem, at the same time treat it. It's the most definitive treatment one would have in today's date.
Isn't it incredible how technology has made it all happen? And how many such surgeries do you do in a day?
It depends on how many people do have problems and how many people fall. On an average, about 30 to 40 arthroscopies a month.
Wow. And is it stressful on your part?
Not exactly. It's like it's a very satisfying job. It's a very, very satisfying job where and each, as you said, it's a new day for you with new people like me. You interact with different kind of people. You get different kind of challenges on your on your job. So it's the same with us. Since that's our core area of expertise, we are equipped in our hospital to handle each and every problem with precision. So it's a challenge for us with some interesting surgeries every day. That's what we're looking for.
That's really reassuring and good to know that as a doctor, you take so much of pride in what you do. And someone who is dealing with knee joint pain or anything to do with their bones and body, this is the things that you'd want to hear from a doctor. So thank you so very much for being out here. We were talking about arthroscopy. What is the advantage of arthroscopy, and what usually is the resting period? If an arthroscopy surgery is done, can they get up and start walking the very same day?
It depends on for what purpose it's done. Basically, arthroscopy could be done for a diagnostic purpose, wherein to recognize the problem, or a therapeutic purpose, wherein a problem is sorted out at the same surgery. Now, an arthroscopy in a milder form, where we need to do a simple meniscal repair or a simple cartilage work, one would allow the patient to walk around the next day and resume his office work in about 3 to 5 days' time. Assuming arthroscopy is done for a ligament reconstruction, like an ACL surgery, that again is a very helpful and a handy procedure and quite comfortable procedure where there's minimal pain. The patient is up and about the next day. But of course, his routine activities like driving car or riding may be deferred for about a couple of weeks' time. Right. But of course, office work can be resumed as early as 3 to 5 days.
Right. You spoke about driving a car. All of us stuck in Bangalore traffic. Yes. After driving our car, we may go and sit in front of our computers, our laptops. Our shoulder is in play a whole lot. Since we are talking about sports injuries, also plenty of techies who listen to the show as well. What are the common shoulder injuries that you've seen with young individuals?
Techies, I would say it's more of a musculoskeletal problems what they encounter. Especially a lot of people come with a muscular problem around the shoulder, like a trapezitis. Very, very, very common. They have a lot of pain in the muscle. They've got a lot of stiffness and soreness in the muscle. And these needs to be treated. One of the easiest way to treat this is a proper physiotherapy, a posture training and stretches. Nevertheless, the young individuals can have severe problems like a rotator cuff injury. They can have dislocations of the shoulder. These need more interventions, would require more investigations to be done. We need to find out where the problem lies and needs to be treated either non-surgical or surgical ways.
Okay. How important is the rotator cuff, and how injury prone are we?
Without an intact rotator cuff, you wouldn't be able to comb your hair, Shriram. So it's as important as that.
Right. So you can't even brush your teeth. You can't go about doing day-to-day activities.
Yeah, day-to-day activities. Rotator cuff is a very, very important structure in the shoulder joint, and for any form of functional satisfaction of your shoulder, you need to have an intact rotator cuff. Now, it's important for the strength of the shoulder, especially moving the arm sideways. A rotator cuff is the most important structure.
Right. Doctor, you did mention about the RICE treatment, but how are sports injuries generally treated? Are there any other ways? Is there any other method that you would recommend highly?
Sports injuries, again, as I said, it's a spectrum of disorders. I mean, you could have a simple sprain, you could have a tear, or else a complex ligament injuries. So based on what form of an injury one has, based on what severity of the injury one has, one could get treated in that way. A simple sprains, simple muscle injuries can be treated in a conservative way, in the sense with some analgesics, that's the painkillers, some amount of heat therapy, resting, and in a little more severe form, one would require physical therapy, that's a physiotherapy, a little bit of strengthening, and in extreme cases where one has a complete rupture of the ligaments or meniscus or cartilage, whatever it is, one would seek surgical help.
Fabulous. At Fortis Hospital, you of course deal with plenty of patients, some noted athletes as well, and I'm sure the amount of psychological stress on athletes is way more when they come into an orthopedic surgery. But can one resume normal sports after sports injuries? And would you recommend that as well?
Yes, of course. I mean, we have a lot many elite sportsmen who have had sports injuries and recovered. See, no sportsman is free from a sports injury. I mean, it's a part and parcel of their profession, and everybody encounters some form of sports injuries in some form or the other. Maybe some people have severe injuries with ligaments torn, and we have seen in the past there are a lot many elite sportsmen who have got these ligament tears, got treated for that, operated for that, and resumed their normal sports. In today's world, where the treatment is quite advanced, there are definitely high chances that one could go back and return to their normal sports.
That's good to know. What is the duration of recovery after an ACL surgery usually?
See, ACL surgery is a very satisfying surgery for the surgeon as well as for the patient. It's as good as the patient is able to walk the next morning. He is able to bend his knee the next morning. He's able to. It's just a day's stay in the hospital. One would go back home and start doing their exercises immediately. One could resume his normal day-to-day activities the following day. Office, if it's a sitting job, one could resume in about 5 days' time. Of course, sports would be deferred for a while.
Right. But apart from that, of course, they can get back to the spring of things and go about life like as though you didn't even have any problems in the first place.
Yeah, as good as one could resume their gym program in about 6 to 8 weeks.
Fantastic.
Yeah.
We spoke about a lot of things involving sports injuries. Listening to everything that you had said, there'll be plenty of people with back problems as well. Of course, technology has played such an important part in making wonders happen. At the same time, there is a drawback as well. People now have the way in which they hold their phone.
Yes.
More and more people are getting aligned to actually having their hands form that way. There are so many other things that we wish to explore as well. Thank you once again for visiting the studios and giving us an insight and being so very informative about how one can go about sports injuries. Anything that you wish to add? What sort of sport do you prefer, Doctor?
What I advise my patients is racket sports. This is one form of sports which gives a lot of endurance to the body. It strengthens your bones, tones your muscle, and of course, other than that, I would suggest swimming because it's a natural way of strengthening the muscles.
Dr. Chirag Thonse, thank you so much for spending time with us. He's a consultant orthopedic surgeon at Fortis Hospital in Cunningham Road.